Hello everyone, welcome back to Fine Nursing Tutorial YouTube channel. In this class, we are going to discuss with ultrasound in pregnancy. We are going to discuss USG in detail in this class. Who all have visited first time on the channel, please do subscribe and watch. Ultrasound, that is USG, is a non-invasive imaging technique using high frequency sound waves. Here they are going to use high frequency sound waves. Here it is absolutely safe for both fetus as well as mother, and then used for monitoring fetal growth, development and well-being. Next we can see the types of methods of ultrasounds. First one is a transabdominal ultrasound. Here it is in a most common, and then probe on abdomen. Requires full bladder ventilation here, and then use in second or third trimester. It's going to use in second or third trimester. It is in a first type of USG, that is transabdominal ultrasound. Second one is a transvaginal ultrasound. Here it is, probe is inserted into the vaginal canal and then commonly used in first trimester. Here this transvaginal ultrasound is used in first trimester and then provides better resolution in the first trimester. And then it is used for detailed pelvic assessment. Also, bladder should be empty for transvaginal ultrasound. And then we'll see the third type of USG, that is Doppler ultrasound. Doppler ultrasound. Here, assess blood flow in umbilical cord, fetal vessels and placenta. And then used in high-risk pregnancies like IUGR, intrauterine growth retardation or restriction, and then preeclampsia. These are the three types or methods of ultrasound, that is USG. Next, we'll see the types of transabdominal ultrasound. First one is a level 1, that is routine USG ultrasound, done between 10 to 14 weeks. This type 1 is done between 10 to 14 weeks. It is used for, this one is used for to confirm pregnancy. It is a best test to confirm the pregnancy, and then to know number of fetus, to know the gestational age here, and then see fetal cardiac activity, that is earliest in the 5 weeks, and then detect only few anomalies like ectopic pregnancy, missed abortion, etc. we can see. And then level 2 ultrasound. Here it is done between 18 to 20 weeks, and then it is also known as TIFA, that is targeted imaging of fetal anomaly, and then also known as anomaly scan or targeted scan it is. And then it is used for, it can detect all congenital malformations, for example spina bifida, cardiac defects, etc. And then next one is third trimester ultrasound. Here it is if needed, monitor fetal growth, assess amniotic fluid volume, to localize placenta, and then check fetal presentation. Here it is very important to check the fetal presentation, and then assess high risk pregnancies. It is done in third trimester USG if it is needed. Okay, here we can see the fetal USG parameters. After USG test, we can see here parameters, measured form, and then purpose, why it is done. Here we can see parameter, the crown rump length. Here it is measured in 6 to 13 weeks. In between 6 to 13 weeks. Why it is done? Purpose is that congenital age and growth, to know the congenital age and growth. And also comes the second one, that is biparietal diameter. It is done in 14 or 14 plus weeks. That is to know the congenital age and growth. And then comes to the third one, that is head circumference. It is also performed at 14 plus weeks, and then to know the congenital age and brain development here, very important. To know the brain development, they are going to measure the head circumference. And then next one, abdominal circumference, best parameter for growth. Here it is going to perform at 14 plus weeks, and then it is to know fetal growth, intrauterine growth restrictions or retardation, and then macrosomia, to know macrosomia. And then last one is a femur length. It is performed at 14 plus weeks, to know the congenital age and growth. This is all about the fetal USG parameters. These are the parameters of fetal USG. Next, we'll see the special ultrasound test. Here, sign of USG and then congenital malformation. Sign of USG. We'll see the sign of USG. First one, increased nuchal translucency. Here, it measures the thickness of fluid filled space. That is congenital malformation. It may be Down syndrome, Turner syndrome, or congenital heart disease. Comes to the second one, that is absent nasal bone. Here, short femur, short humerus. That is to detect, that is congenital malformation, that is Down syndrome. And then comes to the third one here, frog eye sign and also Mickey Mouse sign, that is anencephaly. And then comes to the last one here, lemon sign or banana sign, that's going to indicate spina bifida, congenital malformation, spina bifida. These are the special ultrasound test. Here these are the special special test in that sign of USG, and then also we can identify, through this one we can identify the congenital malformation. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.